Good day everybody, we're going to talk about the renal disorders. First we're going to ask, what are the common renal conditions that dentists are likely to face? The common renal conditions that dentists are likely to encounter are chronic renal failure, nephrotic syndrome, and renal transplants. Chronic renal failure, nephrotic syndrome, and renal transplants. What about the kidney stones? They provide or they give little problems in the dental practice, and they do not interfere with dental practice or require any modification in treatment. The points in the history. First is history of diabetes mellitus, chronic renal failure, related bony disorders, anemia, dialysis. We ask about the type, how often, and the presence of the AV fistula, transplant, when, and associated medications, especially steroids, susceptibility to infections, or recent history of repeated infections, whether dental or generalized. Chronic renal failure. Chronic renal failure has got a lot of manifestations, and it is defined as a low glomerular filtration rate lasting for more than 3 months. Usually leads to hypertension in almost 90% of cases. And the clinical features of chronic renal failure, we will notice that it includes all the body systems, like the cardiovascular with hypertension, congestive heart failure, and atherosclerosis, gastrointestinal, anorexia, nausea, vomiting, peptic ulcer, neurological, lassitude, fatigue, headaches, tremors, sensory disturbances, dermatological, itching, hyperpigmentation, hematological or immunological, bleeding tendency, anemia, susceptibility to infection, and metabolic, there's thirst, nocturia, polyuria, electrolyte disturbances, and secondary hyperparathyroidism. In these manifestations, what gives or what is relative to the dental treatment are the anemia, the hypertension, the heart failure, the peptic ulcer, the bleeding tendency, and anemia. All these should be dealt with. So a chronic renal failure is a systemic disease affecting almost all the body systems. Renal problems in diabetes mellitus. Diabetic nephropathy is the most common cause of renal failure in the Western countries. Anemia in chronic renal failure, the main cause is due to decreased production of the hormone erythropoietin by the kidney, and other causes include renal loss of RBCs, bone marrow fibrosis, and increased RBCs fragility. Renal bone disease or renal osteodystrophy, which leads to bone pain, and this is a very common manifestation or a complaint by the renal patients. What are the causes? First, the electrolyte disturbance with increased phosphate, and this leads to decreased calcium, decreased vitamin D activation, which is performed by the kidney. So in renal failure, vitamin D is not activated, and we get a decreased vitamin D level in the blood, and this leads also to decreased calcium. Both causes of decreased calcium lead to secondary increase in a parathyroid hormone. Third cause, the steroids that are given either to treat the renal disease or to avoid transplant rejection, and we all know that steroids produce osteoporosis. The decreased vitamin D leads to decreased calcium absorption from the GIT and impaired mineralization of bone with increased bone resorption. And this decreases the plasma calcium. The decreased absorption decreases the plasma calcium. The increased bone resorption and the decreased plasma calcium are a stimulus for the parathyroid gland to release the parathyroid hormone, and this increases the plasma phosphate. Also, the impaired renal function decreases the phosphate excretion, and this leads to increased plasma phosphate, which is another stimulus for the parathyroid gland to release parathyroid hormone that leads to bone resorption. Renal dialysis. The types of renal dialysis. The first one is the peritoneal dialysis carried out of the body using the patient's own peritoneal membrane as the semi-permeable barrier. The other type is hemodialysis, which is extracorporeal, outside the body, using a dialysis machine. Surgical arteriovenous fistula is performed for regular large vessel diameter access. This fistula should be protected, and as injury or wounds can result in severe hemorrhage, and this fistula should not be used for any other purpose. This arm should not be used for venipuncture, blood sampling, or intravenous sedation. This is the surgical arteriovenous fistula that is done surgically in order to provide a large vessel access for connection with the dialysis machine. Bleeding tendency. Main causes are: number 1, impaired platelet adhesiveness; number 2, decreased von Willebrand's factor; and number 3, decreased thromboxane. 2 and 3 are decreased clotting factors, and number 1, there is impaired platelet function. Another cause for bleeding tendency is heparin. Heparin is used during hemodialysis to prevent blood clotting in the dialysis machine. However, heparin effects are not prolonged, and dental treatment is best done on the next day after hemodialysis. Nephrotic syndrome, where there's proteinuria, hypoalbuminemia, edema, and hyperlipidemia. Causes are diabetes mellitus and systemic lupus erythematosus. Complications: there's increased factor VIII that leads to hypercoagulability and thrombosis, hyperlipidemia that leads to increased chances and risks for atheroma formation. Treatment is by corticosteroids plus salt reduction in diet and increasing protein content of the diet. Prophylactic antibiotics for the procedures that may cause a bacteremia, and prophylactic heparin. These are the manifestations of nephrotic syndrome that include hypoalbuminemia, the proteinuria, hyperlipidemia, and edema. Proteinuria, hypoalbuminemia, edema, that is most commonly seen in the eyelids. You notice the periorbital edema in this child, as well as peripheral edema as well. And finally, the fourth manifestation is hyperlipidemia. And these are clues to renal disease: ankle edema, periorbital edema. This is how to test for edema by finger pressure. Management of patients with renal disease. First, we have to consult the patient physician before the dental procedures. Best treatment is under local anesthesia, and best treated the day next to the dialysis as platelet function becomes optimal and heparin effect ends. Steroid boost for surgical procedures in patients receiving corticosteroids. Control the hypertension prior to any treatment. Good hemostasis because of bleeding tendency, especially using the desmopressin that has been used to assist hemostasis in cases of prolonged bleeding. Renal failure complicated by congestive heart failure. In left-sided heart failure with dyspnea due to pulmonary edema, pleural and cardiac effusions, do not lay the patient flat. While in right-sided heart failure with lower limb edema, Try to treat such patients in the sitting position, avoiding placing the legs in a dependent position. Renal transplantation. All dental problems should be treated before the operation, before the transplantation. Consult the patient nephrologist first before treating any patient with renal transplantation. Defer the elective dental treatment for 6 months. Renal function is not fully restored in the first 6 months, and the immunosuppressive drugs and the infection risk, these are 2 causes why we have to defer the elective dental treatment after transplantation for 6 months. Emergency dental therapy should be only palliative and preventive, performed in hospital and after consultation with the nephrologist. Oral examination is carried out to detect any opportunistic infections and mycoses due to the immunosuppressive drugs. Drugs and renal impairment. Avoid nephrotoxic drugs such as gentamicin. Avoid tetracyclines. Avoid non-steroidal analgesics. And here, paracetamol is the drug of choice for post-operative pain control. Reduce the dose of all other drugs and take care with drugs used in dental sedation. Thank you very much.